4 women in the U.S. will die from heart disease, the #1 killer of women, but often symptoms go unnoticed. CT Style reporter Megan Yost has more.
Imagine leading a healthy lifestyle, working out, doing everything right, only to find out you have heart disease and need open heart surgery. That's what happened to Sharon Corlett of Plainville. When her gut instinct told her something was wrong, she took action. Take a look. At 68 years old, Sharon Corlett thought she was the picture of good health.
I thought I was fine being in the gym 2 hours a day every Monday, Wednesday, and Friday.
But despite her strict regimen, Corlett told her doctor something felt off.
And I said, but you know, sometimes when I go to the gym, I get on the elliptical, and about 3 minutes into the elliptical, I get a funny sensation, and I pointed here. And I said, it's like an emptiness. It's not a pain, it's not an ache, it's like an emptiness. The whole time I'd be sweating profusely. I mean, dripping.
To her doctor, those were red flags. Immediately, Corlett was referred to the Women's Heart Wellness Center, where tests revealed the unexpected. She had not 1, but 4 blockages in her heart.
To hear this was like shocking, really shocking to me.
In August, Corlett had successful open heart surgery, and her recovery was swift.
5 days later, I was gone home.
Fortunately, Corlett's heart disease was found and treated before it could damage her heart.
I think that you have to really stay healthy all through your lifetime so that if something like this happens, you'll recover quicker.
After her surgery, Corlett completed 3 months of cardiac rehab at the Women's Heart Wellness Center.
I grew stronger every day.
Now she's giving back to other women going through the same thing.
This could be finished by tonight.
She's knitting scarves to be handed out at the center, something she herself received as a patient there last year.
It meant a lot that someone who had gone through heart surgery made something for me to give me comfort and warmth and love. So I'm making scarves and hoping that some woman will wear one and feel like I did when I got mine.
Paying it forward, 1 scarf at a time. For CT Style, I'm Megan Yost.
And joining us now is Sharon's cardiologist, Dr. Heather Swales from the Hospital of Central Connecticut's Women's Heart Wellness Center. Thank you so much, doctor, for joining us.
Thank you for having me.
What a great story there. So. Yeah. Women suffer different symptoms, is that correct, in terms of heart disease?
Yeah, it is true. Men and women often present with different symptoms with heart disease. Interestingly, the most common symptom is chest discomfort, but women tend to experience it as a more mild symptom, and they use different descriptors, like sharp or burning.
Yeah.
Men tend to say pressure or tightness. It's not always that classic dramatic Hollywood heart attack.
Right, where you say, oh, the left arm, I have a shooting pain, and so it's different for men and women just based on our physiology? Or?
Partly, women's blood vessels are smaller. That may be one reason they experience the symptoms differently, and then there's a lot science hasn't figured out.
Sure.
Women, instead of going to the shoulder or arm like men often experience, women will sometimes say the pain goes into the jaw or the back.
Interesting. Now, how do you know, and this is where you, the experts, come in, how do you know this is something I really should go to my doctor for? Because Sharon said she was on the elliptical, which to me kind of makes sense. You're sort of exerting yourself. But what about, I think of my mom or I think of my aunt, who might just be walking down the grocery store. And then, oh, maybe it's just a gas pain or something. How do you delineate?
So anytime the symptoms are lasting more than a few minutes or they're reproducible, meaning, when you go to the grocery store, you're starting to have symptoms that come and then you get home and they go away. And you're seeing it more often, more frequently with less and less exertion. Those would all be signs or clues that you should be contacting your healthcare provider to get checked out.
So when there's a pattern.
Yes.
So this isn't necessarily something that, a pain that presents itself and lasts for hours and hours?
No, typically it lasts about 20 minutes and it is often relieved by rest.
Interesting. But then we'll come back again.
It can come back again when you start to push yourself further.
Modern medicine, we still have so many strides that you all have made, but there's still, still need to figure out how to get to the bottom of that, because that would be very confusing, I would think.
It can be confusing.
So what advice do you give to your patients or to just regular folks, specifically women?
Yeah, so I think anytime they're having new symptoms, they should contact their healthcare provider to talk about them. Women can have many more non-specific symptoms than men, such as fatigue, shortness of breath, trouble with their breathing, sweating, and that was actually one of the things that Sharon noticed. She enjoys dancing a lot, and when she was dancing, she would sometimes sometimes feel like she couldn't complete the dance or she wanted to rest sooner than she used to.
Yeah.
And then she noticed she was sweating a lot when she
Right.
finished, which was something new for her. She
Right.
hadn't had that symptom before.
Tell us about the Women's Heart Wellness Center.
Yeah, so our center opened in 2013 in New Britain, and now,
Congrats.
thank you, and is now open in Southington at the HOCC campus as of this fall. And our goal is to address the unique needs of women with heart disease. We have a comprehensive personalized management plan. We have numerous specialists there.
You have an
cardiac
entire network
sonographers.
to
Yes,
help
yes.
women.
We have an on-site cardiac rehab program, and we're really trying to deliver gender-specific health care for women at risk for or living with heart disease.
Well, you're doing excellent work, and I know Sharon was a great spokesperson there.
Yes, yes,
knitting
yes.
her red scarves,
Yes.
which is great.
Yeah, it's a wonderful program.
And when is the next meeting?
So we have a support network on the New Britain campus that meets monthly through our association with Women Heart, the National Hospital Alliance, which is a national advocacy, support, and education network. Our next meeting is in February, and I think information the 16th on the New Britain General campus, and it's free for any woman at risk for or living with heart disease.
All right. Well, thank you so much.
Thank you. It was very nice to meet you.
Very, very
Thank
nice
you
to
for
meet
having
you.
me.
And for more information or to register for the Women Heart of Central Connecticut Support Network for women with heart disease, please call the number you see at the bottom of your screen. Thank you so much.
Thank you.